Thank you, Chairman. At the outset, I just want to thank Paul Reid on behalf of the HSE. Paul, actually, personally, because I've been following his Twitter during the pandemic, and I think he's been very informative. But certainly all of his team, right down to local level, and I know the staff in Kildare, who I've been dealing with, have been very professional, very committed, and made sacrifices themselves and been very on top of all this. I represent Kildare, which obviously is in lockdown again, is actually the third lockdown effectively that we've had, because we had the original lockdown like everybody else, we had a second lockdown, and then we had a third lockdown unlike other counties. So on that basis, and on the basis of the evidence already supplied, it would be reasonable to suggest or deduce that Kildare has the highest rate of transmission, highest incidence rate, or certainly highest incidence rate per 100,000, etc., per populated density than anywhere else in the country, is the most acute hub of COVID infections right now, according to the, I suppose, advices and the fact that we're under lockdown again. And in that context, I think it's reasonable that every effort should be made towards testing, to ramp up testing, to provide testing, to make it available at all corners, and to remove any barriers to doing so. And my specific issue that I want to raise is, I was made aware recently of an issue where if a patient presents, or a suspected case presents out of hours in Kildare, if somebody goes on a Saturday morning, as actually happened last Saturday to a constituent of mine, to the only out of hours health service available in Kildare, which is called KDOC, unless they have a medical card, they are told they have to pay €50 consultation fee. Now, my understanding, and I confirmed this with the Minister for Health on Saturday, is that the HSE and the state position is that COVID testing referrals are free of charge. No barriers should be put in place of anybody presenting for a test. It's particularly an acute issue. I would say it applies across the country, actually, as a principle, but it's particularly acute when Kildare is in lockdown, as the only county now to be in a third period of lockdown, and appears to be the hub, effectively, the epicentre of COVID in Ireland. So I just want to ask, I suppose particularly put it to the Chief Executive, I have had conversations extensively with KDOC, with their management team, and they advise me that they're aware of the HSE guidance, but my understanding is there's an operational agreement yet to be entered into, or yet to be made, or yet to be signed off on. And I would just say that time is not a luxury here. We don't enjoy time. We're into our third lockdown. We've got 10 days. The clock is ticking to see can we escape from that. We don't know how many more cases are in the community or transmitting or about to be received. If people are being turned away from test centres for the, because they've got to put their hand in their pocket for €50, which they may not have, to get tested, that's frankly not good enough. And I can see both sides of the story, but heads need to be bound together, frankly, and get this resolved. So I hope perhaps Mr. Reid can advise us with good news this morning on that issue. So I'll wait for the answer. Thank you.
Thanks, Deputy, and thanks for your opening comments, which I'm sure our teams around the country and all of the deputies will be well appreciated. Just on the second one, just a second comment or question just around testing in Kildare. I agree, and we have put in significant resources, both pop-up centres throughout the weekend of the emerging outbreaks, and our National Ambulance Services, and a range of home visits, and indeed the extended hours and opening of a range of centres in the county, and supports for that, and indeed outside of the county. The specific out of hours issue, which was in dialogue with the Minister, and always in dialogue with yourself over the weekend, there should not be a charge for out of hours services for COVID referrals. There is a national agreement. The national agreement was about to expire and has been extended, and is still in discussion for a further extension, and that is expected and will happen, specifically related to, and that is all across the country. That's the case. I will ask my colleagues just to specifically get under the bonnet related to KDOC, just exactly what the issue is there. But I know on national level we've extended the agreement. It's extended to all of the out of hours services, and there should not be a charge. So we have to close out whatever that issue is there.
Thank you, and I believe I have 1 minute left, Chair. Just to, I appreciate that, Mr. Reid. I very much appreciate that. I suppose just for clarity, that is an issue of the utmost urgency, because if a patient was to present to KDOC right now, or this evening, in fact, when the out of hours are in place again, as it stands, they would be charged. And I say I don't believe that's good enough. The Minister for Health doesn't believe it's good enough. You don't believe it's good enough. But I think that dialogue has to take place with KDOC. And in fairness to them, they have put forward operational and the lack of agreement, etc., which they would protest. It hasn't happened yet, but it needs to happen as a matter of utmost urgency. So I really appreciate if that can be tackled today. Thank you.
Very much. You might liaise with Deputy Lawless after this meeting. Thanks very much.